Good evening, everyone. Thank you for joining us this evening for tonight's telephone town hall on COVID-19, hosted by Congresswoman Ayanna Pressley. My name is Eric White. I am the District Director for Congresswoman Pressley here in the Boston office. This evening we are joined by the Congresswoman, by Rita Nieves, who is the Executive Director at the Boston Public Health Commission, Dr. Jennifer Lowe, Medical Director at the Boston Public Health Commission, Nadine Cohen, Managing Attorney within the Consumer Rights Unit at the Greater Boston Legal Services, and Jade Brown, Staff Attorney specializing in housing and consumer law, also at the Greater Boston Legal Services. Before we get started, I do want to run through a couple of housekeeping measures. If at any point you would like to ask a question of the Congresswoman or of any of our guests, please press *3 on your phone. Again, that is *3 on your phone, and that will take you to a lobby to ask your question. We may not be able to get to everyone's question tonight, but we are taking them down and we will respond to you after this call is over. And I will be periodically reminding folks that, again, if you want to ask a question, it is *3. And with that, I will now turn it over to Congresswoman Pressley to kick off tonight's town hall.
Thank you to my District Director, Eric White, and my entire dedicated A-Team staff, several of whom are joining us on this call to offer support in answering your questions, as well as to take copious notes from issues that you will raise in light of what you are experiencing, seeing, and feeling in the midst of this pandemic. I also want to thank our Zoom operator, Stephanie. These Zoom meetings, or rather our TeleTown hall operator, Stephanie. This is our second TeleTown hall, and on COVID-19 specifically, and we've been participating in marathon Zoom meetings and other ways to stay connected virtually, and so these facilitators and operators are certainly essential, and they are working late and long hours to support us in getting information out. So I do want to thank Stephanie for the role that she's playing. And again, this is our second TeleTown hall focused on the COVID-19 response. It is our goal in this TeleTown hall to provide you and your family with the information and the resources that you need. We know knowledge is power to protect your health and your financial well-being during this crisis. As for everyone's spirits, this is an unprecedented crisis, and it does require from us unprecedented coordinating, information sharing, and might I add, unprecedented hope in the face of all of this. This has tested our faith, our resilience, tested our communities, but we will get through it together. So I personally appreciate the opportunity to build community and to connect with you in this tele way. So we're grateful for technology so we can do that. Like so many of you, I am sober by the time we find ourselves in, but I do continue to be heartened by the community that we continue to build together as we collectively get through this unprecedented crisis. I would be remiss if I didn't acknowledge that tonight is the first night of Passover. So I appreciate those of you who are choosing to spend some of your evening with us, and hope everyone has a wonderful holiday. We will make sure that we're moving with deliberate speed to ensure that this TeleTown hall wraps before sundown. So again, thank you for those who are observing Passover for participating. So much has happened since our last TeleTown hall, so I want to use this opportunity to provide a brief update on our most recent relief package. This is the third relief package. This is the CARES Act, and I want to give you an idea of when our communities and families can expect to see some much needed help and support to mitigate the hurt that all of our families are experiencing and feeling. 2 weeks ago, Congress passed the CARES Act. This is a $2 trillion bill that will invest in our state and local COVID response efforts. The bill will provide one-time payments for individuals and families and strengthen and expand unemployment support, and provide some much-needed resources to our small businesses hit hard by this crisis. The CARES Act will provide direct cash assistance to individuals and families with Social Security numbers ranging from $1,200 to $2,400, depending on your reported income and family size. In addition, the CARES Act will also provide $500 for each child under the age of 18. Individuals and families who filed taxes in 2019 or 2018 and received funds by direct deposit can expect rebate payments, their payment in their account beginning next week. For those who didn't receive their return by direct deposit or did not file, you still qualify and can head to the IRS website to learn more about how to add your account information or to file a simplified tax return. I know many of you are taking notes. I'm going to repeat the top lines of that one more time, but I also want you to know that this TeleTown Hall is being recorded and will also be posted on our website so that you can revisit it. But again, the CARES Act provides direct cash assistance to individuals and families with Social Security numbers ranging from $1,200 to $2,400, depending on your reported income and family size, and $500 for each child under 18. Individuals and families who filed taxes in 2018 or 19 and received funds by direct deposit can expect rebate payments in your accounts beginning next week. For those who didn't receive their return by direct deposit or did not file, you do still qualify and can head to the IRS website to learn more about how to add your account information or to file a simplified tax return. The CARES Act also provides supports for small businesses. We know that these are the lifeblood of our community and our economy, and that these businesses are simply too small to fail. They are essential to community, they are job engines, and critical to the fabric of our community. So the CARES Act also provides support for small businesses. And the businesses that are eligible, yes, I've been getting this question a lot, include bodegas, barber shops, beauty salons, nonprofits, faith-based organizations, and independent contractors. The bill provides over $560 million in low-interest and low-fee economic injury disaster loans. You may have come across documents, for those of you who have already applied, where they use the acronym EIDL. That stands for Economic Injury Disaster Loans and Grants, and small business owners can apply using the SBA's streamlined application on their website. Now, this is first come, first served, so I want to encourage small business owners to get in the queue and to apply quickly. I also wanted to just reiterate again that I know you're taking copious notes. This TeleTown Hall is being recorded and will be posted, and you can access that at presley.house.gov. My first name is not actually a part of the web domain, the address. So you'll be able to re-access this recording and this information by going to presley.house.gov. I want to continue providing information so far as relief for our small business owners. Small business owners will also be able to begin applying for forgivable loans through the Paycheck Protection Program, often referred to as PPP, not to be confused with PPE. The Paycheck Protection Program, PPP, a program that provides forgivable loans to small business owners in need of money to cover payroll, mortgage, rent, and utility costs. Again, these are forgivable loans. Underscoring my previous point, these loans are available on a first-come, first-served basis, and small business owners are encouraged to apply as soon as possible. Folks are advised to reach out to your bank to see if they are participating in the program. If not, the SBA website has a list of approved lenders. The CARES Act also includes a major expansion of unemployment. Now, I do have to say that the bill that we were given by our colleagues across the aisle was really just a massive bailout for corporations. We want a bailout for the American people, for the people of this Commonwealth and the Massachusetts 7th. Democrats fought hard, given the unprecedented hurt, to see unprecedented expansion when it comes to unemployment insurance. There are many aspects that we fought for that unfortunately were not included, but this one is encouraging, and it is unprecedented in how these benefits have been expanded and the breadth of who is now eligible to collect unemployment benefits. So the bill will provide an additional, for those that are already collecting unemployment or who've been laid off in response to this pandemic, the CARES Act will provide an additional $600 per week on top of UI. So the cash assistance that we're providing. So unemployment insurance. So if you were already collecting unemployment insurance, I apologize, we use a lot of acronyms in government. So if you were already collecting unemployment insurance, UI, you will receive an additional $600 on top of those benefits for a period of 4 months. The bill also, the CARES Act also extends benefits to those, again, who have traditionally not been eligible. This is unprecedented. And now self-employed folks, independent contractors, gig workers, part-time workers, artists are all eligible. Now, I know there's been a ton of confusion around when folks can begin applying for these additional benefits. The IRS issued initial guidance, and let me pause there for a moment. So we continue to fight to center the humanity, the dignity, and to provide relief for every individual, family, and worker. Again, everything we fought for, we did not get in the CARES Act, but there were some things we were able to get. We have been awaiting guidance from federal agencies about the distribution of these funds. So we fought for the funds and the allocations, but the federal agencies determine the implementation. And so that is the thing that we have to continue to be vigilant in, to make sure these funds are getting to you as quickly as possible. So the IRS issued initial guidance, and we hope to learn more in the coming days so that the Commonwealth can begin to disperse this aid to workers. In the coming days and weeks, my team and I will continue to conduct effective and efficient oversight to make sure that this administration is implementing the CARES Act the way they should. That's also why forums like this are so important, so we can receive direct feedback from you if you are managing any barriers or challenges in the implementation process. And as Congress continues its work on a fourth package, I will continue to fight to make sure that the needs of the Massachusetts 7th are centered. I will continue to fight to ensure our immigrant neighbors are not left behind. This virus does not discriminate, and therefore response and relief efforts should not, based on race, income, or immigration status. I do believe that the next package must provide student debt cancellation, a crisis that existed long before this crisis and is only being exacerbated as this economic downturn continues. We need robust financial assistance for all, regardless of immigration status. We need to continue to make massive federal investments in our community health centers who service our most vulnerable. We need to halt all evictions and mortgage foreclosures and protect our neighbors experiencing homelessness as well as vulnerable populations like our incarcerated men and women. Our collective health and destinies are tied. We are in this together. Now, we're lucky to have some experts join us tonight who have offered their public health and consumer protection expertise. My team has received so many questions from constituents on how to best keep themselves and their families safe and how to navigate challenges paying rent and dealing with creditors and even debt collectors during this unprecedented pandemic. So we wanted to bring the experts to you during this call. At this time, I'm happy to pass the proverbial mic over to Ms. Nieves, who joins us from the Boston Public Health Commission to provide some additional critical updates on how to keep you and your family safe and healthy.
Can you hear me? Can everybody hear me? Yes?
Yes.
Good. Thank you, Congresswoman Pressley, for inviting me to participate in this town hall on our COVID-19 pandemic and asking me to speak about our Boston response. I'm joined in this forum by Dr. Jen Lowe. She's our medical director at the Boston Public Health Commission, and she'll have some short remarks after me. She'll speak more about racial, ethnic data, and she'll give it an update. I just want to put this pandemic into context in our great city, and wanted to start by saying that Boston started our public health response to COVID-19 in mid-January 2020. We activated our incident command to guide our public health response, and in late January, and with our Mayor Martin Walsh, we declared a public health emergency on Sunday, March 15. In reality, we started preparing for this pandemic and this issue years ago. The Boston Public Health Commission, as the City Health Department, has an Office of Public Health Preparedness, which has led our responses to H1N1, the Boston Marathon bombing, extreme weather emergencies, and other emergencies we've had to deal with throughout the years. This Public Health Preparedness Office maintains an ongoing communication system with all Boston hospitals, health centers, and long-term care facilities so that when we need to scale up responses, they're positioned to do so. Our City of Boston Mayor Martin Walsh has demonstrated exceptional leadership on this. He activated the city's Emergency Operations Center to ensure that all city departments are working together and that all city departments maintain a focus on Boston's most vulnerable residents. Boston is a very unique city which contributes to our robust response to this pandemic. We are a center for health care with many acute care hospitals and community health centers, and we have a community health center in practically every neighborhood in our city. We are also a center for higher education, as we know. The fact that Boston is a city that attracts lots of international travelers, it wasn't surprising to us that we were one of the first 5 cities to identify a resident with COVID-19, and this happened in early February. As of this morning, the Department of Public Health reported on their website 16,970 confirmed cases in Massachusetts, and 433 have died, unfortunately, in the state. 511 individuals have been tested so far in our state. In Boston, in particular, as of this afternoon, Boston reported 2,502 confirmed cases with 30 deaths reported. We're also pleased to report that many of our residents have recovered from this virus, and in Boston we have 289 people who have recovered so far from this illness. Based on our assets in our large sectors, other city agencies, and our robust system of community-based organizations, our immigrant organizations, and faith leaders, to name just a few, we have been able to respond and to reach into many of our communities. 2 Fridays ago, we started issuing weekly data reports. The data we have been able to report has been by gender, age, and zip code. Last week's data report showed us that just under 44% of Boston's COVID-19 cases are residents under 40 years old. This critical information has driven communications and other interventions targeting this particular group. Anyone familiar with the work we've done over the years at the Boston Public Health Commission is aware that racial and ethnic health disparities are a driver of the work we do. We collect, analyze it, and publish it in order to guide public health efforts in Boston. Like others, we are frustrated by the lack of racial and ethnic data available to us. We're working very hard with the state, our healthcare providers, and our own systems to ensure that racial and ethnic data is collected so we can understand infection rates, access to testing, and other health outcomes, and to continue to guide our response. Dr. Lowe will speak briefly at the end about race, ethnicity data shortly and where we stand with that. In our planning efforts, we're using predictive modeling from the University of Washington. It uses Massachusetts level data, not Boston specific, but based on this modeling, we have identified April 10th through the 20th in Massachusetts as when our peak resource needs will happen in our state. We're ramping up planning efforts with hospitals, communication, and resource needs, and with city and community partners for the spike. If the data shifts, the model may shift, but it is critical. It's a critical planning tool that we use. While we continue to respond and are working hard to lower the curve and limit the harm to our residents in the next few weeks, we are already preparing for our recovery. We know that this virus will disproportionately impact our most marginalized and vulnerable residents. For example, our older residents, low income, those who are homeless or live in overcrowded situations, and those with underlying health conditions. And we know that our Boston residents of color are disproportionately represented in those groups. One of the greatest strengths of our city is collaboration. We have been working with other city departments, including jobs, housing, and immigrant advancement, to reach our residents. Our city is already at work on mortgage and rental supports and small business loans, to name just a few. And our mayor's Office of Immigrant Advance and Food Access Office are working hard to ensure that all of our residents have access to the resources they need now and in the upcoming months while we recover. Dr. Lowe will speak briefly about data and what we know about racial ethnic data and efforts to expand on race ethnicity data availability.
Thank you, Rita. Boston Public Health Commission is working very hard to better understand COVID-19 infections within the population, as well as potential differences in the race-based COVID-19 experience. We have limited access to race and ethnicity data at this time due to the fact that only 45% of reports provided to us by Massachusetts Department of Public Health have this information. That being said, we have an entire team using our data to understand and analyze the epidemiology of this disease, and we do have a lot of information that can help us understand racial differences in COVID-19 disease. As Rita mentioned, we distribute a weekly report that looks at demographics of each positive case based on neighborhood-level data, gender, and age. We also just recently received access to total tests performed by zip code, both positives and negative results. Our team is currently working to analyze this data, and we will release it shortly. This will inform us on access to testing by neighborhood. What we hope to present soon, we have various efforts in analyzing our current data. For example, we have access to the Boston Behavioral Risk Factors Surveillance System data. Through this system, we know that we have elevated risks of chronic conditions such as diabetes among our Black and Latinx residents, and are using this information to understand the COVID-19 experience. We are also looking at differences in race and ethnicity in hospital emergency room utilization for COVID-19-like illnesses. And we also have established a team of health equity champions at Boston Public Health Commission to reach out to the individuals with a diagnosis of COVID-19 to gain more information about the demographics of those affected. At Boston Public Health Commission, we want to ensure that all residents in Boston have equitable access to services needed to prevent, diagnose, and treat COVID-19, and this data will help us achieve that. Thank you very much.
Thank you. Sorry, this is Eric White again. I just want to remind everyone that if you have a question at any point in this call, you can dial *3. Again, that is *3, and you will be able to get that question in the queue.
Thank you, Eric. And I was actually speaking a moment ago, but I was muted, so I apologize for the pause there, everyone. Thank you to both of our public health experts. And now we'll introduce Ms. Cohen, a consumer protection expert from the Greater Boston Legal Services, to offer some brief updates on how workers and families can protect their financial well-being during this challenging time. Ms. Cohen?
Thank you. Thank you so much, Congresswoman Pressley, and thank you for all that you do. We're really fortunate in Massachusetts to have you fighting for economic and racial justice for all of us, and your leadership really is a true bright spot in these otherwise dark times. I want to tell folks a little bit about what Greater Boston Legal Services is doing to help low-income people navigate this new coronavirus world. We provide free legal services to very low-income people in the areas of consumer, housing, unemployment, immigration, health and disability, welfare, CORI, family law, and domestic violence. Our offices are closed right now, but our staff is working remotely. And while we cannot take all cases, we are available to give advice in some areas. Some of the areas we're dealing with right now include foreclosures. We are trying to get state legislation that will stop foreclosures during the state of emergency. In the meantime, the Massachusetts Division of Banks has issued guidance that is asking financial institutions to postpone all foreclosures for 60 days and to allow borrowers to defer their mortgage payments, waive late fees, and not report negative information to the credit bureaus. On the federal level, the CARES Act has a foreclosure moratorium on federally backed mortgages. Those are loans by FHA, Fannie Mae, Freddie Mac, and VA. And you can go online to find out if your loan is a federal loan. Many private banks and servicers have their own programs in place to let borrowers defer payments. Banks such as Bank of America, Chase, Citi, and others have these programs. Go online to their websites to see what they're offering. But I warn you that the phone lines are jammed, so it's very difficult to call. Just remember, it's unlikely there will be foreclosures during the state of emergency in Massachusetts. But if you can pay your mortgage, do so, because any money that you defer, you will be owed, and you'll have to figure out a way to pay it. In terms of evictions, the courts are closed, and eviction cases have been postponed to at least May 4th. However, if you've already been taken to court and your landlord won and got an execution, you may still be at risk for eviction. Also, if you do get a court summons and complaint during this period, try to file an answer with the court. And in terms of the CARES Act, there is some protection from eviction for tenants in subsidized housing, but not in private housing. We are hoping to get state legislation that will prohibit evictions, and we hope that that will be coming out in the next week. In addition, Boston has established a $3 million fund to help tenants pay rent, and I understand that they are taking applications now. In addition, there is a RAFT program that provides some assistance to tenants. In terms of debt collection, the Attorney General has issued regulations prohibiting most debt collection activity. And again, we're trying to get legislation for a statewide moratorium on debt collection activities, including wage garnishment. If you are called or sued by a debt collector, do not agree to make any payments at this time. Your money needs to go to food, health care, rent and mortgage, and other necessities before you pay on debts. And do not agree to give your stimulus checks to debt collectors. We're trying to make those monies not subject to any kind of attachment. In terms of utility shutoffs, there should be no utility shutoffs in Massachusetts during the emergency. In addition, cell phones and internet service, most companies have agreed to voluntary not shutting off phones and internet. So those should really be something that you have access to. I just want to add one thing, and that is people be careful of scams. There are going to be people out there who are going to target consumers and try to get your $1,200 stimulus check. So be careful, and nobody is going to call you and ask you for your Social Security number and bank account information. As the Congresswoman said, the IRS has that information. And I'll just add, if people do not have bank accounts, there will be paper checks that will be going out at some point later down the road. So for more information on Greater Boston Legal Services, you can go to our website at gbls.org. And at the top of the page, you can click on the COVID-19 link, which will give you a lot more information. There is also a good compilation of information at another website, masslegalservices.org. And if you go to their COVID-19 page, they will present you with a lot of additional information. My colleague Jade Brown and I will be available to answer questions relating to these consumer issues and foreclosures and evictions.
Thank you. Thank you, Nadine.
Sorry, Congresswoman, go ahead.
Thank you, Nadine. And I did just want to say, underscoring Nadine's point about, those predators and people that are exploiting this unprecedented hurt and exploiting people and the real fear and the desperation. So thank you, Nadine, for offering that guidance on consumer protection. And I also just wanted to say that that's also why we continue to fight for access for those that are historically marginalized, disenfranchised, and underbanked, which is by and large low income and communities of color. Right now, the only way that we can quickly get money to people is with existing infrastructure, and that is why they made it about, or one of the I won't call it, I guess it's a concession. I don't know, certainly not, we didn't want the access to be limited in any way, but that's why it was limited to Social Security numbers and tax ID. And again, we know that leaves a lot of people out in terms of getting access to that urgent and immediate relief that they need. And so for those that don't have direct deposit, you are waiting for checks in the mail. And again, we know that there are many more that are at disadvantage due to many people, and certainly I grew up in one of those families, being underbanked. Okay, so I think we're ready for constituent questions.
Great. So again, if you have a question that you would like to ask, even if we run out of time, please do get your questions in the queue by hitting *1 3. We will begin taking questions now, and any questions that are not answered on this call, the staff will be following up with answers to your questions. But we will jump right into questions. We will start with Lewis in JP, who has a question for the Congresswoman.
Hello, Congresswoman.
Lewis, are you there?
Yes, this is me.
Yeah.
Hi.
Hi, Lewis.
Thank you for taking the time to call us and inform us, because there's so much information going around, and it's nice to actually get the call back and saying, hey, this is actually real and not fake. So I appreciate that. With regards to student loans, are there any benefits that will be applied to the students? And if there are, is there also any forgiveness with regards to loans?
Okay. So I've been from the very beginning, in my tenure in Congress, and certainly in the midst of this pandemic, pushing for student debt cancellation. A minimum, Senator Warren had a bill proposing a minimum of $10,000. Myself and Representative Omar, we were pushing for $30,000 because we know that's the average debt that a typical federal borrower is saddled with. What we were able to get in the CARES Act was not student debt cancellation, despite our efforts, but we were able to get all federal student loan payments to be halted or paused until September, so you don't have to worry about making payments or interest accruing during this time. I will continue to push for student debt cancellation. This is a $1.6 trillion crisis. In Massachusetts, we have 855,000 borrowers. And I know that many like to frame this issue as a millennial issue. It is not. I'm 46 years old. I have peers that are still paying their student debts. There are seniors that still owe student debt money, and they have had their benefits, and many workers have had their wages involuntarily garnished. We've even had teachers lose their licensure when they went into debt so that they could get the schooling, the education, to be an educator. So we will continue to push for student debt cancellation as a way to relieve you of some debt, one more bill to take that off your minds and your back, and it will also, I believe, jumpstart the economy. And so we'll continue to push for student debt cancellation. So in addition to payments being paused or halted until September so you're not accruing interest during this time and you're not making payments, we were also able to get in the CARES Act them to stop making involuntary garnishments of wages and benefits. Thank you, Louis, for your question.
Thank you.
Great. So our next question will come from John. John has a question about collecting Social Security, and this question will go to Jade Brown. John, are you there?
Yes, I'm here. Yes.
You're live.
Mr. Brown. I'm here. Hello?
Yep, we can hear you.
Hi, Mr. Brown.
Oh, I was to Mr. Brown. My question is not about Social Security. It's what the Congresswoman has said about the checks going to anybody but that was filing taxes. I collect Social Security, and I haven't filed taxes in years. Will I still get a check?
Sure, that's true for a lot of people.
Yeah. So what's the clear answer? I'm sorry if I'm not used to talking on the phone like this, but anyways, I heard very colorfully said yesterday by Senator Lindsey Graham that if you're breathing, you get a check. So, but I want to verify that with you.
That's correct.
Oh, it's correct. Wow. All right.
Yes, I do want to say that at the beginning, so let me just say this, Mr. Brown. That's why it's so important that we continue to hear from you about questions, a lot of misinformation, but also there are barriers to implementation. Initially, there was guidance that you would have had to have filed your taxes for 2018 or 2019 to be eligible. And because of hearing from voices like yours and our pushing back, we were able to get them to change courses midstream, as it were, and to change that guidance, because we know that there are so many seniors who don't file and others who don't file taxes who are living on fixed income, and then we were creating a layer of bureaucracy for them in the midst of a crisis. So we were able to get that reversed.
Thank you. My name is not Brown; it's McGowan. I don't know where they got the Brown from.
But I'm in, Mr. McGowan.
I'm from your district, and I've seen you when you were campaigning for City Councilwoman Gurley. So yes, I appreciate it very much, and I'm very happy that you're my Congresswoman.
Mr. McGowan, yes.
I'll add that on.
Okay. All right.
But thank you for your information. Thank you.
Okay.
Great.
All right, Mr. McGowan.
Thank you for that. Okay, we're going to go to our next question. Our next question comes from Kelly, who has a question about unemployment.
Hi, Ayanna. Thank you for taking my question. I just filed for unemployment last week. I haven't even received that first paper check yet. But earlier when you were speaking in regards to unemployment benefits, you had said something in regards to an additional $600 being given to. How will that come?
So I understand you have not received the check as of yet, but the good thing is that you are already in the system. I know it can't come fast enough, but you are already in the system and in the queue. Some of the challenge and frustration for our states has been, they're awaiting guidance from these federal agencies, and it's continued to switch in terms of how soon people could expect a check. And the governor was looking for the funds to begin to add that additional $600. So we've been sort of twixt in between. But the bottom line is, yes, you will eventually get that check. You will have an additional $600 on top of what you were already going to receive, and that will be true for 4 months. So I'm sorry for the wait time. We know that, people are hurting and they need this money right away. It has been frustrating. The Commonwealth is still waiting for guidance, further guidance to get these resources out the door. So it's our understanding that the checks, whether you're talking about direct cash assistance or unemployment benefits, could come anywhere from 3 to 10 weeks. Those are some of the numbers that I've been provided.
Great. Thank you, Congresswoman. We're going to move on to the next question. This next question comes from Carla. I believe this will be for the Boston Public Health Commission. Carla, are you there? Carla? A question about medical professionals?
No, that must be a different Carla. My question was, are we going to follow the guidance of the medical professionals or of the federal government? Because we're not trusting the political decisions that they're making, not the medical decisions.
Thank you for that question.
Okay, well, while we're awaiting one of our public health experts to answer that question, I will just tell you, and Dr. Fauci, I trust. And I think that, we should have been much more strident much earlier. There will be time for us to take this administration to account for what I believe has been criminal negligence and disinformation that continues to happen at these press briefings, and a sluggish response to this pandemic. I know the governor had requested 1,000+ ventilators and was given 100. So this is sort of what we're dealing with, and that's why it is so important. And I know we make it a point, and I'm on the phone with our state and municipal partners every day, creatively resourcing and leveraging what we do have, but we should not have to rely upon the benevolence of the private sector or private citizens to be safe. So I am urging everyone, and I will be doing some public service announcements I thank, the governor for being one of the early governors to put into place a stay-at-home. I thank our mayor for the new guidance that he's provided around a curfew, as well as instructing everyone to wear cloth masks when you are out. And you should only be out for essential needs, groceries, and prescription drugs. It is really critical that we continue to limit contact and to flatten the curve.
Hi, this is Rita. Can you hear me?
Yes.
Can you hear me? So thank you for that question, Carla. Well, obviously, we listened to some of the recommendations that CDC has put out and some of the educational materials and guidelines that they have put out that have been helpful. We also have worked very carefully with our State Department of Public Health and with our network of healthcare providers here in the city. Certainly, this pandemic looks slightly different from city to city, from state to state. So we have really been focusing on what is it that we're seeing here on the ground in Boston, and what is it that we're hearing from our hospitals and our providers to make thoughtful decisions as to what recommendations to put into place, the timing of those. And as you can see, our mayor has been very responsive and very thoughtful on how to roll those out. And we have not made any decisions, in a rush. We've tried to be very thoughtful as to what are the things that we're asking people to do, and what are the impacts of some of the recommendations and advisories that we have put out there, so we can have a good balance. So just like, Congresswoman Pressley was saying, we need to continue. The next 2 weeks are very, very critical. People have been doing a good job, but the next 2 weeks is about doing what we've been doing, but doing it better, and continue to practice social distancing, all the prevention measures that we have discussed. The issue of face covering is very important, because I'm sure you've heard that up to 25% of people who may be positive are walking around among us without symptoms. So because they don't have symptoms, obviously they don't know that they may be putting other people at risk. So the face covering is really, it's an affirmation of that reality, and it's also it's a way to be responsible with your family, your friends, the people at work, in your community. If you're wearing a face covering, and if you are positive and don't know it, you're minimizing the air droplets that you're putting out into the air, and you're minimizing the opportunities for you to infect other people. So we're using our common sense and grabbing everything that's out there in terms of guidelines, and consulting with our peers and colleagues at the state, and trying to make sense of everything that is going on, and really adapting it locally the way it makes sense, and adapting it to our communities in our city.
Absolutely, and I do just want to say, as the Congresswoman representing the Massachusetts 7th, which includes Boston, Cambridge, Somerville, Randolph, Everett, Chelsea, and Milton, I am grateful for the resourceful, efficient, competent, and compassionate response. And just again, unprecedented times require unprecedented coordination, and we are all on the phones all day, every day, about the best ways to ensure the public health. I do also just want to note one of the points that was made earlier by our public health experts is that the data informs the models, and that is why I've pushed so hard from the very beginning for the collection of racial and ethnic data in real time to be disaggregated and to be publicly shared. We are already collecting age and gender, and because that data is being collected and shared publicly by many throughout the country, we know that this is a virus that has hit men harder. We also know anecdotally, again, reiterating some of what our public health experts shared, that those communities that have historically lacked access to health care, or who live in food deserts and have higher incidences of diabetes and heart disease, or have experienced great environmental injustices and also have higher rates of asthma, we know are more susceptible, and if contracting COVID-19 suffer the most severe consequences. 80% of those who will contract COVID-19, they'll go through hell, but they will recover. 20% of those that contract COVID-19 will suffer the most severe consequences and perhaps lose their lives. So continue to honor CDC guidelines, get those that you in your community, in your family, your neighborhood to do the same, and join my call for this race data collection because it will directly inform how we marshal and direct our resources. Okay, it's really critical, and also to ensure that access to testing and treatment is equitable. Okay, we're going to keep moving here because we're trying to get more questions in before sundown at 7:15 for those that are observing Passover.
Great, thank you, Congresswoman. Actually, I am seeing a bunch of questions come in specifically around the rebate and wanting a little bit more information around that. So Jade, if you could just tee up a little bit about the rebates.
Thanks. So in regards to the rebate, I believe there was an earlier question about the rebate as well. There are income cutoffs. So if folks are making less than $75,000 for individuals and less than $150,000 for married couples, then they will receive the maximum rebate amount. Folks that make more than that, but less than $99,000 for individuals and less than $198,000 for couples will get slightly reduced rebate, and folks who make more than those amounts will not get any rebate. And for Social Security recipients and other railroad retirees, their benefits, their rebate, would be administered the same way as their benefits. So if they're receiving their benefits by direct deposit, then that's also how they would get the rebate.
Great, thank you for that. We're going to try to get one more question in. Again, we will be reaching out and answering questions that were not asked on the phone, but we're going to go to Joseph L., who has a question on housing.
Thank you. First, I just want to say, Congresswoman Pressley, you are a true progressive, and we are extremely lucky to have you here representing us. My question is... Thank you, ma'am. My question is, I have a housing voucher, but I'm in a private home, and I was hoping for reassurances that we're safe. Residents like me are safe throughout this.
Thank you so much for your question, and Aisha, correct me if I'm wrong. If you could speak to that, or Sarah, that was something that we were able to get included in the CARES package. Is that correct? Yes. Okay. So the CARES Act that just passed. Yes, you are safe. You do not have that to worry about. You have a federal voucher, and we were able to get into the CARES Act a moratorium on evictions. If you want to discuss more specifics, you can contact my office, and Sarah, if you'll provide that number, or Eric, my district director.
Yep. So anyone who has a question, please feel free to follow up with the district office. We are teleworking as well, but we are still working. 617-850-0040. Unfortunately, I think we have run up against our time here.
Okay.
So thank you to everyone again. I want to remind everyone that we will be answering your questions that were not asked live. And I would just like to offer the Congresswoman an opportunity to close us out here.
Again, just on that last question, just wanted to reiterate again, this is only for federal vouchers, okay? And this is not a one-off conversation. We are here as a resource and a support. And you can reach us again at 617-850-0040. We have also created a resource link and page at presley.house.gov, which is regularly updated, and we will be having further town halls, teletown halls as well. But please do remain in touch and let us know if you're experiencing any challenges or barriers when it comes to the implementation of the CARES Act. Please also do elevate for us what is important to you and what you would like to see in the next relief package that the House looks to move on. Everyone, please stay safe, stay healthy, and do everything that you can to try to preserve some joy in the midst of all of this, because that is critical in the face of such an unprecedented crisis. Thank you.